Welcome to the Playing Books podcast.
Hello.
Today we're embarking on a deep dive into a book that's, well, pretty much essential for anyone navigating pregnancy. What to Expect When You're Expecting, by Heidi Murdoff and Sharon Mazel.
It really is a classic, isn't it?
Totally. Think of this as your express route to the most important insights as you prepare for this huge life event.
Yeah, whether you're just maybe starting to think about having a baby, or you're currently pregnant, or even supporting someone who is, our chat today is really designed to pull out the most helpful, most reassuring knowledge from this, let's face it, pretty comprehensive guide.
It's hefty.
It is. We'll be looking at the different stages, tackling some common questions, and highlighting the really practical advice in the book.
Exactly. Our mission today is to navigate this big resource and bring to light the info that's going to be most insightful and hopefully comforting for you. We'll cover a whole range of topics, from those super early signs of pregnancy right through to getting ready for labor and, what comes after.
That's good.
Okay, let's unpack this. So the book kicks off by emphasizing something fundamental: understanding your body's own rhythms, specifically your menstrual cycle.
Exactly. Tracking your menstrual cycles is, well, it's key. It helps estimate when you're ovulating, and from there, figure out a likely due date.
Right.
The typical range for a cycle is somewhere between, say, 23 and 35 days. Keeping a menstrual calendar, just like the book suggests, helps you see what's normal for you. And that allows for a more refined due date estimate once you actually conceive.
That makes sense.
And it's also worth noting, if your cycles are irregular, then paying attention to other ovulation signs becomes even more important.
Okay. And then, for many people, the next big question is obviously, am I pregnant? The book goes into quite a bit of detail about how those home pregnancy tests actually work.
Yes, they do. These tests are basically designed to detect HCG, that's human chorionic gonadotropin. It's a hormone that the developing placenta starts producing pretty soon after the embryo implants in the uterus.
When is that usually?
Typically around 6 to 12 days after fertilization happens.
Okay, here's where it gets really interesting, I think. The book points out that even though your body is making HCG, the levels might just not be high enough for a home test to pick it up in those very, very early days.
That's absolutely right. So while HCG might be present in your urine maybe a week after conception, it might not hit the detection threshold for a standard home pregnancy test. Which is why testing too early, say like 7 days before you expect your period, could easily give you a false negative result, even if you are actually pregnant.
Right, that can be such an anxious wait.
It really can. Understanding that detection window helps manage expectations,
Definitely. And what's usually the very first signal that makes someone think, maybe I should take a test?
For a lot of people, it's that classic sign, a missed period. But the book also mentions that other sort of subtle sensations might be happening down in your lower abdomen. Have you ever wondered what those might be?
I have, yeah. What kind of subtle clues could your body be sending out in those first few weeks?
Well, these sensations can really vary. It could be the feeling of implantation itself, that moment when the fertilized egg, which is now this tiny ball of cells, starts attaching to your uterine lining.
Wow.
There's also increased blood flow to the whole area. The uterine lining is thickening up, and the uterus itself starts its initial growth spurt, which can sometimes feel like, mild aches or growing pains.
Okay.
And the book also notes that digestive changes like gas pains or bowel spasms because of constipation, which is another really common early symptom, can sometimes be mistaken for pregnancy feelings.
Gosh, it's amazing how many tiny shifts can be happening so early.
Right.
The book also tackles a really common first trimester worry, this feeling of not feeling pregnant. Has anyone talked about that kind of anxiety?
Oh, absolutely. That lack of sort of concrete physical proof in the very early stages, it can be really unsettling for some people. Without the more obvious things like a growing belly or feeling those first little baby movements, it's totally natural to wonder if everything's progressing okay. The book does offer reassurance that early pregnancy symptoms vary hugely from person to person.
That's good to hear. Yeah. Okay, let's shift gears a bit to a phase that's crucial even before conception, preconception health. The book has some really valuable advice here for both partners, right? Let's start with male fertility.
Right. The book really highlights the significant role of a man's body mass index, his BMI, in fertility. Research suggests men with a BMI in the obese range are more likely to struggle with infertility compared to guys in a healthy weight range.
Interesting.
Yeah, and the book even mentions that something like a 20-pound weight increase could potentially bump up the risk of infertility by about 10%.
Wow, okay.
So for couples planning a pregnancy, getting to a healthy weight for both partners is a really positive step you can take together.
Good point. And for both men and women hoping to conceive, there's one piece of advice in the book that just couldn't be clearer or more vital.
Yes, absolutely. The book strongly emphasizes how critical it is to stop smoking. Not just for improving fertility for both partners, but also, crucially, for the long-term health of the future baby.
That makes sense.
Quitting smoking significantly boosts the chances of conception, and it dramatically cuts the risk of serious pregnancy complications, including the awful risk of SIDs, sudden infant death syndrome.
Okay, a really important message there.
Yeah.
Now, as the pregnancy moves along, the book spends a lot of time helping you navigate all the physical changes and, let's be honest, discomforts that can pop up. It's all part of the package, right?
Exactly, it is.
Yeah.
And the book points out a pretty clear link between carrying extra weight, whether that was before pregnancy or gained during, and being more likely to experience common issues like backache, varicose veins, swelling, and heartburn.
Right.
It's another reason why that focus on healthy habits throughout the book is just so important.
And the book guides you through these changes, often month by month. Let's maybe zoom in on this 6th month. That's roughly weeks 23 to 27. What are some common things people experience then?
Okay, yeah, the 6th month. Well, one of the most exciting things is often really starting to feel the baby's kicks and movements more distinctly. That can be incredibly reassuring.
I bet.
But the book also mentions other common things like an itchy belly as your skin stretches. You might also notice you're a bit clumsier, maybe some numbness or tingling in your hands, those really annoying leg cramps. Your belly button might start popping out, becoming an outie. And for many, finding a comfy sleeping position becomes a real nightly quest.
Oh, those leg cramps. They can wake you right up.
Mm.
Does the book offer any practical tips for dealing with them?
It does, thankfully. When a leg cramp hits, the book says to immediately straighten your leg and gently flex your ankle and toes up towards your nose, not point them down.
Okay, flex up.
Yeah. And it also suggests a preventative stretch. Stand about 2 feet from a wall, put your palms flat against it, and lean forward, keeping your heels flat on the floor. That helps stretch out the calf muscles.
Good tip. And what about other noticeable body changes? The book talks about breast changes, for example. What can someone expect there?
Yes, normal breast changes often include the areola, that's the area around the nipple getting darker and maybe spreading out a bit. Those little bumps on the areola, the lubrication glands, they become more noticeable.
Okay.
And you might also see blue veins becoming more visible under the skin. The book is quick to reassure readers that these changes are usually temporary, just part of your body getting ready for breastfeeding.
Right. Another super common topic. The constant need to pee. Why does that happen so much?
Frequent urination, yeah, it's definitely normal. It's due to a mix of hormonal shifts and the simple physical pressure of your growing uterus pushing right on your bladder.
Makes sense.
The book explains those hormones can also increase blood flow to your kidneys, which means they produce more urine more often.
And sometimes people mention feeling slightly breathless, even when they're not really doing much. Is that
Yeah.
typical too?
Mild breathlessness is pretty common, especially starting in the 2nd trimester. It's partly because pregnancy hormones actually tell your brain's respiratory center to make you breathe a little faster and deeper. And then later on, as the uterus gets bigger, it presses up on your diaphragm, that big muscle under your lungs, which can just make it feel a bit harder to take a really deep breath.
Okay. Interestingly, the book even mentions a kind of odd taste sensation some pregnant people get. Metal mouth. Have you heard of that?
Yes, it's a strange one.
Cool.
Some women report this persistent metallic taste. The book actually suggests a simple fix. Try rinsing your mouth a few times a day with a weak baking soda solution, maybe a 1/4 teaspoon in a glass of water.
Baking soda. Interesting.
Yeah, it can help neutralize the pH. It also suggests chatting with your doctor or midwife about your prenatal vitamin, as sometimes certain formulations might contribute to that taste more than others.
Good to know. Okay, let's pivot now to something really critical for a healthy pregnancy: nutrition and healthy habits. The book puts a huge emphasis on eating well.
Absolutely. It makes it really clear that women who eat a nutritious, regular diet throughout pregnancy tend to have a lower risk of delivering preterm, they often recover faster after birth, and find it easier to manage their weight postpartum. It's all linked.
So what exactly is the pregnancy diet, according to the book? Is it totally different from just general healthy eating?
Not really, no. The book emphasizes it's very much in line with the standard healthy diet, but with some, important tweaks to meet the higher needs for calories and certain key nutrients during pregnancy.
Okay.
The focus is really on a balanced intake. Lean protein, calcium-rich foods, whole grains, lots of colorful fruits and vegetables, and healthy fats.
Calories during pregnancy always seem to be a hot topic. How many extra does the book generally suggest?
The general guideline it gives is needing about an extra 300 calories per day, assuming you started at a healthy weight. But it does note this can vary by trimester. In the first trimester, you might not need any extra calories at all. The need typically increases a bit in the second trimester and might go up to around 500 extra calories a day towards the end when the baby's growth really accelerates.
Got it. And when we talk specific nutrients, the book gives a really thorough overview. What are some of the key vitamins and minerals that are especially important?
Okay, well, it highlights vitamin C, think citrus fruits, berries, melon, tomatoes, broccoli. It also stresses beta-carotene, which your body turns into vitamin A. So carrots, sweet potatoes, spinach, kale, winter squash are great sources.
Lots of color.
Exactly. Don't forget all the other brightly colored fruits and veggies for their minerals and those beneficial plant compounds, the phytochemicals.
What about some of the other big ones we hear about, like B12 and vitamin D?
Yeah, vitamin B12 is crucial, particularly if you follow a vegetarian or vegan diet, since it's mostly in animal products. The book advises ensuring you get enough, maybe through fortified foods like soy milk, cereals, nutritional yeast, or meat substitutes, or possibly a supplement. Vitamin D is another really big one. The book points out many people, pregnant or not, are low on it. Sunlight helps, but dietary sources are limited, things like fortified milk, juice, sardines, egg yolks. Often not enough during pregnancy.
So maybe talk to your doctor.
Definitely. Discuss your levels with your provider and see if a supplement is needed.
And folic acid and iron, they always come up. Why are they so critical?
Yes, and the book notes they're so vital for the baby's development and mom's health that they're almost always included in prenatal vitamins. Folic acid is key for preventing neural tube defects like spina bifida,
Right.
and iron is essential to support all that extra blood volume you create during pregnancy and to prevent anemia.
Okay. For those of us maybe with a sweet tooth, does the book offer healthier ways to satisfy those cravings? Any alternatives to just plain sugar?
It does. It suggests opting for natural sweetness from things like fruit, dried fruit, and maybe fruit juice concentrates when possible. These give you sweetness plus vitamins, minerals, and those phytochemicals we mentioned.
Good idea.
Hmm.
There's a nice phrase in the book about choosing good foods, remembering where they came from. Can you unpack that a bit?
Yeah, it's a lovely way of saying prioritize minimally processed foods, foods that are as close to their natural state as possible.
Right.
The book encourages choosing fresh, seasonal fruits and veggies, or good quality frozen or canned ones. Just watch out for added sugar, salt, or unhealthy fats. It also highlights cooking methods that keep nutrients, like steaming or light stir-frying, and trying to eat some raw produce every day.
Makes sense. The book even has this helpful idea called the Pregnancy Daily Dozen for fruits and veggies. What does that kind of look like?
Yeah, it gives serving suggestions to aim for daily. Things like having a serving of citrus fruit, maybe some melon, berries, a carrot, a sweet potato, a tomato, a bell pepper.
Okay, a good mix.
Yeah, and it also recommends adding 1 or 2 servings of other fruits and vegetables just to get a really broad range of nutrients.
And naturally, alongside all the good stuff, the book is very clear about habits to avoid. What are the major no-nos?
Absolutely. The book is explicit. Some habits can really undermine everything else, even a great diet. These include drinking alcohol, using tobacco, and taking any unsafe or non-prescribed drugs. Just avoid them completely.
Okay. What about herbal teas? Lots of people find them comforting, but is there anything to be wary of during pregnancy?
The book does advise caution with herbal teas, mainly because there's often not a lot of solid scientific research on how they might affect a developing baby. So while some might be fine, others could potentially pose risks. It specifically mentions a red raspberry leaf tea, saying large amounts might stimulate contractions. Generally, the FDA is cautious about most herbal teas during pregnancy and breastfeeding.
So the takeaway is,
Definitely check with your doctor or midwife. They can give you a list of teas they consider safe for you personally.
good advice. The whole issue of chemicals in our food is a big worry for many people now. How does the book handle this topic for pregnancy?
It tries to offer some balance. It states that most substances in food haven't actually been proven harmful to an unborn baby. But, it's wise to minimize potential risks where you can.
So what are the strategies?
Things like prioritizing that nutrient-dense pregnancy diet, cooking from scratch when possible, maybe choosing organic options if feasible and affordable, opting for natural additives over artificial ones,
Okay.
generally avoiding nitrates, and nitrites often found in processed meats like hot dogs, salami, smoked fish, and making smart choices about fish.
Right, the mercury issue.
Exactly. Avoid the high mercury types like shark, swordfish, king mackerel, tilefish, tuna steaks. Focus instead on fish rich in those brain-boosting omega-3s like salmon or sardines, but stick to recommended serving sizes.
Okay, that's helpful. Let's move on to some common questions and maybe misconceptions the book tackles. A big one is always about the safety of sex during pregnancy.
Yes, a very common question. The book reassures people that sex is generally considered safe throughout all 3 trimesters in a normal, low-risk pregnancy.
Good to know.
It does mention there might be specific situations, like certain complications where your doctor or midwife might advise limiting or avoiding sex. So always best to have an open chat with them. But the main focus should be on comfort and maintaining intimacy, even if things need adjusting.
And there's often a worry, particularly for first-timers, about whether an orgasm could somehow trigger a miscarriage or cause early labor. What's the book's take on that?
It addresses that fear directly. It explains that while the uterus does contract naturally after an orgasm, these contractions are usually mild and brief. In a normal pregnancy, they aren't considered labor contractions and are generally harmless.
Okay.
But again, if there are specific risk factors in your pregnancy, your provider will give you tailored advice.
Got it. On a lighter note, the book even gives some tips for how couples can keep enjoying intimacy during pregnancy, even when things feel different. What are some suggestions?
It encourages focusing on the positives, the closeness, the relaxation, the intimacy itself. It suggests being adventurous, maybe trying different positions to find what's comfortable as the body changes.
Makes sense.
And it really emphasizes realistic expectations and just open, honest communication with your partner about what feels good and what doesn't.
Okay. What about other, maybe more cosmetic concerns, like belly piercings? Are they risky?
The book says if a belly piercing was fully healed and healthy before pregnancy, it's generally safe to keep it in. It shouldn't interfere with the baby or delivery, even a C-section. It clarifies that your belly button's connection in the womb was to your own mother, not directly to your baby.
Ah, interesting distinction. Now, something many pregnant people experience, unfortunately, is unwanted belly touching from others. How does the book approach that?
Yeah, it acknowledges this happens a lot. People are often well-meaning, but it can feel intrusive and uncomfortable. The book basically says it's perfectly okay to politely set boundaries and let people know if you'd rather not be touched.
Good. And sometimes people worry they're showing too soon. What could be behind that?
The book lists a few possibilities. It could just be your dates are slightly off, or maybe more significant bloating and gas, which is really common early on, or even just more bowel distension from constipation.
Okay.
In some cases, it could be an early sign of multiples, but the book cautions that an early bump isn't a reliable sign of twins on its own.
Right. Managing stress and looking after your overall well-being is so vital during pregnancy. What strategies does the book recommend for coping with stress?
It suggests a whole range of healthy options. Things like regular gentle exercise, walking, swimming, prenatal yoga are great. It also mentions potential benefits from complementary therapies like biofeedback, acupuncture, massage, meditation, visualization.
Lots of choices.
Yeah, and just prioritizing relaxation techniques in general.
Massage sounds wonderful,
Right.
but are there specific guidelines for prenatal massage mentioned in the book? Any precautions?
Yes, there are some important safety points. It advises finding a licensed massage therapist who's specifically trained in prenatal techniques.
Okay, that's key.
Definitely. It generally suggests avoiding massage in the first trimester and stresses using proper positioning, like avoiding lying flat on your back after the 4th month. The therapist should use unscented oils or lotions and avoid deep pressure on certain spots, like the ankle bone, heel, and the abdomen itself.
Got it. Cravings, another huge pregnancy topic. Any advice from the book on handling those intense urges?
The book suggests trying to find healthier substitutes first, things that might satisfy the craving but also offer some nutrition. It also mentions using distraction, just taking your mind off it.
But sometimes you just need the chocolate.
Exactly, and the book acknowledges that. Occasional small indulgences are perfectly fine, in moderation, as long as it's not something harmful, obviously, and it doesn't consistently push out nutrient-rich foods.
Okay, balance.
Yeah.
Even simple things like wearing sunscreen daily are mentioned. Why is that important during pregnancy?
Absolutely. The book recommends making sunscreen with SPF 15 or higher, ideally 30 plus PSI, a daily habit. Your skin can become more sensitive to the sun during pregnancy due to hormonal changes, making you more prone to sunburn and potentially melasma, those darker patches.
Good reminder. What about skin conditions like eczema? Did pregnancy affect them?
It can. The book notes that pregnancy hormones might worsen eczema for some people, but surprisingly, others might find their eczema actually improves or even clears up during pregnancy. It's quite unpredictable.
Getting enough sleep can be a real challenge, especially early on and later. What advice does the book give for getting better rest?
It really stresses tackling fatigue. It suggests establishing a consistent bedtime routine, using pillows strategically for comfortable positioning, making sure your mattress and room temperature are good for sleep, getting fresh air daily.
Okay.
Being cautious with sleep aids, always talk to your provider first. Maybe trying calming scents like lavender, reserving the bed just for sleep and sex, and only going to bed when you actually feel tired. Oh, and avoid sleeping with covers over your head.
Right. Keep the air flowing. And what about those awful tension headaches that can pop up? Any management tips?
The book suggests trying relaxation exercises, resting in a dark, quiet room, maybe lying down with your feet slightly elevated. It also reinforces getting enough rest generally. But interestingly, it notes that oversleeping can sometimes trigger headaches too. So finding that sweet spot is key.
Okay. For people working during pregnancy, the book covers workplace safety. What are some key things to consider?
It highlights being aware of any workplace substances to avoid, mentioning OSHA guidelines. For physically demanding jobs, heavy lifting, prolonged standing, it suggests talking to your employer about a possible transfer to lighter duties around 28 weeks, as there might be an increased risk of preterm delivery.
That's important.
Yeah, and it also acknowledges the impact of emotionally stressful jobs and emphasizes finding ways to reduce that stress during pregnancy.
Dental care, another piece of the health puzzle. What's the book's guidance there?
It strongly recommends getting a dental checkup and cleaning at least once during pregnancy, ideally earlier rather than later. Okay.
It mentions low-dose nitrous oxide, Latin gas, is generally considered safe after the first trimester if needed for a procedure, but advises against heavier sedation. And always check with your main healthcare provider about antibiotics if any dental work requires them.
Right, coordinating care. As pregnancy moves along, thoughts naturally turn to, well, actually becoming parents. The book offers some realistic perspectives on that shift.
It does. It advises keeping expectations about newborn life realistic, reminding you that crying is how babies communicate, and adjusting to interrupted sleep and routines is just part of the deal.
Good to remember.
And the book strongly recommends taking a good childbirth education class and emphasizes these classes are valuable for both parents.
Why does the book push those classes so much? What are the main benefits?
Well, they offer a great chance to connect with other expectant couples, which builds a nice sense of community. They really involve the partner, giving them knowledge and tools to support you.
That's crucial. Definitely. And crucially, they educate you both about labor, delivery, pain relief options, and give you hands-on practice with comfort measures that can be incredibly helpful when the time comes.
Okay, makes sense. As the due date gets closer, the book dives into the third trimester, even mentioning developmental milestones like around week 32. What's going on with the baby then?
Yeah, week 32, the book notes the baby's typically around 4 pounds, maybe 19 inches long. It's a busy time for development. The baby is actively practicing survival skills, swallowing, breathing movements, kicking, sucking.
Wow.
And their skin is becoming less transparent as more fat builds up underneath, getting ready for the outside world.
Choosing a pediatrician is another big job before the baby arrives. What advice does the book offer?
It suggests starting your search around the beginning of the third trimester. It recommends scheduling chats consultations with potential doctors.
What should you ask?
Ask about their office setup, their stance on breastfeeding support, procedures like circumcision, if that's relevant to you, how they approach antibiotic use, the schedule for well baby visits, check their board certification and which hospitals they're affiliated with.
Good checklist.
Yeah.
As delivery nears, the baby's position becomes important. The book talks about anterior versus posterior. Can you explain that?
Sure. Anterior position means the baby is facing your back, the back of their head is towards the front of your belly. This is usually the ideal position for labor, often makes your belly feel firm and smooth.
Okay.
Posterior means the baby is facing forward, towards your belly button. This might make your belly feel a bit softer or flatter. The good news is the book reassures you that most posterior babies actually turn during labor.
Oh, good.
Yeah, and it mentions that doing pelvic rocks on your hands and knees might help encourage a posterior baby to rotate.
Worth a try.
Yeah.
Now, anticipating labor itself, exciting and maybe a bit scary. Our excerpt didn't detail the whole process, but it did touch on reasons why labor might be induced.
Right. The book clarifies it's not just about being overdue, though that's one reason. Induction might be recommended if your water breaks but contractions don't start, or if there are concerns about the baby's well-being or the environment inside the uterus, or if the mother has health issues like preeclampsia or gestational diabetes, or even if there's a risk of not getting to the hospital in time once labor starts quickly.
Understood. The book even gives some basic but vital advice for that incredibly rare scenario of an unexpected birth outside the hospital. What are the key steps?
Yeah, very rare, but good to know. The absolute first step is call for emergency help immediately. While waiting, try to stay calm, find a clean surface if you can, gently support the baby's head as it comes out.
Okay.
Check if the umbilical cord is around the neck. If so, gently try to loosen it, deliver the shoulders one at a time, then immediately get the baby onto the mother's chest, skin to skin, and keep them warm with blankets or whatever is clean and available.
Crucial steps. What about eating and drinking during labor? What does the book suggest?
It suggests that light, easily digestible snacks in early labor might help keep your energy up. But it also cautions about potential nausea. Generally, a big meal isn't recommended during active labor. Your hospital team will give you specific guidance based on their policies and your situation.
Right. Fetal monitoring is standard practice. The book mentions external and internal. What's the difference? When is each used?
Okay, external monitoring uses sensors placed on your belly to track the baby's heart rate and your contractions. Internal monitoring is a bit more direct. A tiny electrode is placed on the baby's scalp, and a thin catheter might go inside the uterus.
Why use internal?
It gives more precise readings. It's typically used if there are concerns about the baby or if the external monitor isn't getting a clear trace, maybe because of movement.
Gotcha. Comfort measures during labor can make a huge difference. What techniques does the book highlight for coping?
It lists quite a few helpful things. Different breathing patterns, relaxation techniques, changing positions, often walking, rocking, sitting, leaning forward, hands and knees, side lying. Also massage and counter pressure, firm pressure on the lower back or hips during contractions, which can feel really good.
Good options to have. Arriving at the hospital in labor can feel like a whirlwind, especially the first time. What's the general process like upon arrival, according to the book?
It usually starts with registration or check-in. Then you'll likely go to a triage area for an initial check. A nurse will ask about your history, contractions, if your water broke, check your vitals, listen to the baby's heart rate.
Okay.
You'll probably sign consent forms. Depending on how far along you are, they might do an internal exam to check your cervix, how dilated and effaced it is. If your water hasn't broken, they might discuss breaking it artificially. Then eventually you move to your labor and delivery room.
And the transition phase, often described as the toughest part. What does the book say about that stage? What might you feel?
Yeah, transition is intense. The book says contractions get longer, stronger, much closer together. Pain increases. You might feel intense pressure low down in your back, perineum, maybe even rectal pressure with a strong urge to push.
Wow.
You might see more bloody show. You could feel hot or cold, shaky, have leg cramps, feel nauseous, maybe drowsy but unable to rest. Emotionally, it can be a really vulnerable, maybe overwhelming time.
Okay, good to be prepared for that intensity. And then finally, the incredible moment, what happens right after the baby is born, according to the book.
That amazing moment. The book describes getting that immediate skin-to-skin contact, cuddling your newborn. If you plan to breastfeed, that first feed might happen very soon after birth. Meanwhile, the medical team is focused on delivering the placenta and checking you for any tears that might need repairing, or if you had an episiotomy.
A lot happens quickly. The book also briefly touches on special circumstances, like having multiples. What are some key points there?
It notes that carrying multiples does mean a higher risk for certain things, like preeclampsia. These pregnancies often involve seeing a maternal fetal medicine specialist, an MFM, who's an expert in high-risk situations.
Okay.
It also briefly mentions the importance of good team care if you have existing chronic conditions like diabetes or fibromyalgia, and it touches on other topics like different types of miscarriage, preeclampsia signs, what to do for umbilical cord prolapse, a rare emergency, postpartum care for tears, signs of infection after birth, and even the potential downsides of strict bed rest.
Got it. And in that immediate postpartum period, what key things does the book prepare new parents for?
It describes what to expect right after both vaginal and C-section births, like continued monitoring, maybe having a catheter removed, being encouraged to start moving gently. It offers self-care tips for common discomforts, like using sitz baths or ice packs for soreness down there. Very. It also stresses starting postpartum Kegel exercises again to help regain pelvic floor strength. And crucially, it tells you when to call your provider postpartum, things like excessive bleeding, foul odor, large clots, fever, persistent pain. And it normalizes the baby blues, reminding you they're common and usually pass.
Wow, we have covered a lot, but really only scratched the surface of everything packed into what to expect when you're expecting. We
Yeah.
really hope this deep dive has given you some valuable takeaways and maybe answered some questions you had.
This book truly is an incredible resource, isn't it? It covers the whole journey with detailed explanations, practical advice, and just a generally reassuring tone for every single stage. We definitely encourage you, if you haven't got a copy, to maybe grab one and really delve into the sections most relevant to you.
Absolutely. The authors, Heidi Murdoff and Sharon Mazel, have created such a supportive guide. We'd also encourage you to maybe engage with Heidi Murdoff and the whole What to Expect community online, on social media, for more info and support.
Yeah, great community.
And we challenge you. Take the ideas and advice from this book and really let them enhance your pregnancy journey, or even just your understanding of it, whether it's adopting healthier habits, feeling more prepared for labor, or knowing what to expect postpartum. The knowledge in these pages is genuinely empowering.
Well said. Thank you so much for joining us for this deep dive into what to expect when you're expecting, right here on the Plain Books podcast. We really hope this conversation was informative and hopefully engaging for you.
And we invite you to follow, subscribe, and please share the Plain Books podcast with anyone you think might find it helpful. Until our next deep dive, take care, everyone.